Can COVID-19 cause erectile dysfunction? This question has been on the minds of many since the pandemic began in early 2020. With COVID-19 having varied and lasting effects on a significant number of recovered patients, it's no surprise that scientists have been investigating its potential impact on men's health, specifically on erectile function. Let's delve into the work of Dr. Jim Hotaling, a leading expert in male infertility and director of the Men's Health Clinic at the University of Utah Health. He and his team embarked on a unique study to determine whether the COVID-19 virus could be found in semen. Dr. Hotaling revealed, "We found that the virus isn't showing up in semen, and it seems this finding is consistent with similar studies being conducted across the globe. Nonetheless, it's worth noting that while there's no evidence to suggest COVID-19 affects the testes or sperm long-term, certain illnesses can impact sperm count in the short term." Dr. Hotaling explains, "Generally speaking, when men recover from COVID-19, their sperm counts and hormone levels all seem to be normal. The only caveat here is that any illness that carries a fever impacts sperm count for 60 to 70 days. So what about the numerous articles online claiming that COVID-19 does indeed cause erectile dysfunction?" Dr. Hotaling advises caution when interpreting these reports, given that they often rely on very small sample sizes. He underscores the importance of considering all variables before drawing conclusions. Time is a crucial variable in the ongoing quest for information about COVID-19. Dr. Hotaling and his team are determined to use it wisely to find more answers. "There are plans to keep going with research on this topic," Hotaling says, "and we also want to see if there are any consequences for the offspring of men who had COVID-19. In conclusion, while it's clear that COVID-19 can have lasting effects on the health of recovered patients, the link between the virus and erectile dysfunction remains inconclusive. It's important to approach this topic with a discerning eye and to rely on comprehensive, well-conducted studies for information. As research continues, we expect to learn more about the long-term health implications of this novel virus. With scientists like Dr. Hotaling and his team at the helm, we can anticipate more answers in the future. For now, it's safe to say that the claim of COVID-19 causing erectile dysfunction remains largely a question rather than a definitive fact.